Hi, I'm Dr. Michele Evans. I want to talk to you about a basic fertility evaluation. A basic evaluation can be done in many situations. One situation would be a couple who's been trying to conceive for a certain period of time without having a pregnancy. Another could be for a person who is not ovulating or having regular menstrual cycles who would like to conceive, or for same-sex couples who might require donor sperm, or a same-sex couple who may require an egg donor and a surrogate. I'm going to go over the basic evaluation with you, going over all parts, and some of these may pertain to you, some of them may not, depending on your situation. A basic evaluation looks at 4 things: egg supply, sperm supply, the uterus, and the fallopian tubes. I want to take you through all 4 of these things, and let's start with egg supply. We think that a person is born with all of their eggs and uses them up during their lifetime. The eggs that we're born with are microscopic and they're stored in the center of both of our ovaries. Each month, a group of eggs moves from the center of the ovaries to the surface, becoming the available group for the month. And from this group, naturally, for someone who has a normal menstrual cycle, only 1 egg will grow and release. At the end of the month, the entire group is lost. So each month we lose a group of eggs and typically only use 1. This same thing happens every month of our life until all of the eggs are gone. And when the eggs are gone, menopause will happen, and that happens around the age of 51 on average. We start a basic evaluation with egg supply testing, which is done with an ultrasound and a blood test. The ultrasound looks for small black circles on the surface of your ovaries that are called follicles. These follicles are about the size of a pea. They are fluid collections, and each fluid collection has a microscopic egg inside of it. The follicles that we see are the group of eggs that are going to be lost that month. People who have a higher egg supply have more follicles. People with lower egg supply have less. We expect that younger people will typically have more follicles, and as we age and we use up our eggs, our follicle count will go down. So when I do the ultrasound, I'm looking to see what your follicle number is and if it is average for your age or higher or lower than average. On the same day, we would look at blood work, and these are hormone markers of your egg supply, which may include AMH, FSH, and estradiol. These markers are also going to give information about egg supply, and they're going to be put together with the ultrasound findings to have a very confident understanding about your personal egg supply. When an ultrasound is done to look at egg supply, this is the same time when I would look at the uterus. When looking at someone's uterus, I want to note if the uterus has a normal size, a normal shape. Are there fibroids? Are there polyps? Is there something there that might stop an embryo from attaching? If something is seen, we might take a step further in a uterine evaluation, which might include a fluid ultrasound, might include an MRI, or an HSG test. The final evaluation would be an evaluation of the fallopian tubes. The fallopian tubes are really important structures in the body. They come off of each side of the uterus, one on the right and one on the left. The fallopian tubes are the place where an egg and sperm meet and where an embryo forms. So they're really important in the start of a pregnancy. People can have blocked fallopian tubes. If one fallopian tube is blocked, it can decrease the pregnancy rate by 50%. And if both are blocked, it can drop the pregnancy rate to 0 without further treatment. When fallopian tubes are blocked, there are typically no symptoms or side effects. Menstrual cycles remain the same, and there's typically no pain. So the way that we know if a fallopian tube is open or closed is having a test done called a hysterosalpingogram, which is also known as an HSG test. This is an X-ray, It's typically performed in a radiology department at a hospital and is done between menstrual cycle days 7 to 11. It's done by putting dye through the uterus and the fallopian tubes and looking with X-ray to see if the dye passes through the tubes. The final part of the evaluation is the semen analysis, looking at sperm parameters. The sperm parameters that are important are the volume, which is the amount of fluid that's in the cup when a sperm sample is given, the concentration, which is how many million sperm there are per milliliter of fluid, the motility of the sperm, which is the percentage of sperm that are moving forward, and the morphology of the sperm, which is the shape of the sperm. That's our complete evaluation. Egg supply testing, uterine testing, fallopian tube testing, and sperm testing. Once the basic evaluation is done, we can figure out the best next steps to help you to achieve a pregnancy. Hope that this was helpful. If you have any questions, please don't hesitate to reach out to the office or schedule a consultation.